Today we are going to discuss about the fourth year BRC nursing, midwifery and obstetric nursing viva question. The first question for you: the average length of the umbilical cord is 60 centimeters. The placenta starts functioning fully by which week? 12th week. What is the organ to develop in the embryo? Heart. Which organ is primarily responsible for drug metabolism? Liver. What is the normal duration of pregnancy? 42 weeks. During fetal development, both the testicles descend into the scrotum by which week? 48th week. And what is the weight of the uterus? 60 to 70 gram. The pH of vagina during pregnancy? 3.8 and 4. And what is the color of the amniotic fluid? Is a pale straw color. Name the compound that is present in amniotic fluid. That is protein, lipid, and glucose. Uric acid. Newborn baby maturity rating is done using ABGA score. Baby Friendly Hospital Initiative was launched by in the year of 1993. What is the term for a woman never give birth? Nullipara. Which hormone is primarily responsible for maintaining pregnancy? Progesterone. So what term we will be using for the signs of pregnancy? Amenorrhea. The best time to hear the heart sound using a Doppler is 10 weeks. The normal fetal heart rate 120 to 160 beats per minute. Seizure is the complication of eclampsia. Lochia serosa occurs 4 to 10 days. When the first dose of TT given in pregnancy after confirm. And which presentation is most common in labor? Vertex. Apgar assist at first and fifth minute after the birth. What is the term for the first fetal movement felt by the mother? Quickening. Most common cause of abnormal uterine bleeding in reproductive age is ovulatory dysfunction. Emergency contraceptive copper-T. Most common site of ectopic pregnancy is fallopian tube. The best diagnostic test for endometriosis is laparoscopy. Pap smear is used for detecting cervical cancer. Most common benign tumor of the uterus is fibroid. Which hormone urged just before ovulation? LH. Chocolate cyst is seen in endometriosis. Gravida refers to the number of pregnancies. Which vitamin is essential to prevent neural tube defect? Folic acid. Natural contraception method is lactational amenorrhea. Which test confirms the rupture of membrane? Nitrazine test. Clomiphene citrate used to induce ovulation. Best indicator of fetal well-being is non-stress test. What do you mean by MTP? Medical termination of pregnancy. What are the methods we can use? Manual vacuum aspiration, suction, dilatation, and evacuation, curettage, T, misoprostol. In case of rupture ectopic pregnancy, the standard treatment is self-injectomy. What do you mean by placenta previa? Placenta previa is complete or partial covering of the internal os of the cervix with the placenta. Abruptio placenta is a premature separation. What are the management? You can administer blood, crystalloids, and you can use indwelling catheter, CVP line. Clotting time you have to monitor. Immediately delivery you have to conduct. What do you mean by toxemia of pregnancy? They will have high BP. What do you mean by pre-eclampsia? Hypertension. That is, the blood pressure is 140 by 90 mmHg with the proteinuria. After 20th weeks, edema, ankle, and then blurred vision, shortness of breath, the liver enzymes will increase, pain in the upper belly. What do you mean by polyhydramnios? So this is the presence of excess of amniotic fluid of more than 2000 ml. What do you mean by oligohydramnios? Is a condition in which the amount of amniotic fluid is reduced to less than 200 ml. So what do you mean by multiple pregnancy? That means twin pregnancy. Siamese twins means conjoined twins. That, for example, the head will be joined and then the other parts will be joined between the one twin, between the one baby and another baby. Triplet means 3 fetus. Quadruplets means 4 fetus. The placenta Fenestrata, that means the central portions of the discoid placenta is missing. What is the action of methyl dopa? Is antihypertensive. Keep watching and subscribe, and I'll continue with this in the next part. Thank you.